Good afternoon. Oh, is that a little loud? I'd like to introduce myself first. I'm Ernest Armann. I'm from the Stettlium, and I'm the representative for the Lower Stettlium Council. We're actually split in half, our tribe, and and it causes some challenges for us. And I think, because we're working towards unity, we're working towards nationhood. We're looking to take on our responsibility in our jurisdiction, in our territory. And that goes to and applies to everything. And the work that we're doing here and the social determinants, based on health, I think really is where the work has to be. We really look at the needs of our nation and what it is, and we need to start from a healthy place. We need to start from a wellness place. And so we look at the work, I tell everybody usually that I'm a recovering band manager. I worked in my community for 15 years as a band manager, and I've seen way too many things, way too many needs, way too many challenges, way too many limitations, way too many barriers, lack of resources, lack of people and time. And because you're always dealing with somebody else's policy. And so when this process started, and we developed the strategic plans and we adopted good governance and all these different pieces, to me that was our success. And when we started to really look at the work, and what was in the marching orders, and it's in the Bible that we have, that Doug talks about. And in my view, I seen a long time ago the real value of establishing those deputy ministers table. And to be able to have the opportunity to have a real discussion around policy that impacts us. And that's a barrier, it's a limitation, it's a restriction on us, and to create that, we created that dependency. And to me, one of our biggest challenges, poverty, is breaking that dependency in our nationhood and taking our responsibilities back. And when Wayne talks about the children and the systems, there's too many systems for us. The systems are in education, systems are in child protection, systems are in how we use our own land and our resources, and that imposing, and I always talk when I work in my tribe, we talk about self-government and the responsibilities that go along with that, with our responsibilities to the land and our title. And to me, I always say, we only need to give ourselves permission to become self-governing. We don't need anybody else's permission. And so when we look at the work here and we started saying, well, what's going to happen now? We did transfer, and all that great work, and we thought we did a lot of good things, but in my view, we just started the work, and we hear that from our elder Cliff and our other members that talk about that. And because now is the time to really make a difference, to make that change. The opportunity is just starting. And we only need to give ourselves permission to do that. And we have to be a little bit organized. And there is a general structure in the province right now and in First Nations land on how we approach and deal with government. But I think now that title recognition is given, it's up to us just to take that and take on that full responsibility for what it means to be self-governing. And it's also in the aspect of, it's not just the politics, the economics, but I think for us it's about taking care of the people first. All of our people. And that responsibility, in my view, is paramount for us to achieve, and it's to be able to recognize and be able to realize our true place back on our lands and our responsibilities for all of us. So when I really look at this work, and we looked at the social determinants, and we're talking about education, we're talking about health, we're talking about wellness, and wellness is tied to our land, it's tied to the protection of our foods, it's tied to environment, water, fish. All these things have a lot of responsibilities tied to them. And we already know how to do that. We have to rediscover that. We have to start cooperating, collaborating together to achieve that base of power, that position of power that we're going to be able to have to influence the provincial government and the federal government and what they do, what they're doing to us. Because right now I see a lot of deficiencies going on, especially on the land. There is an inability for government to protect that land based on their minimal standards. There's an opportunity for us to really start taking our place on the land and taking care of that guardianship, because it is for our benefits. It's going to help support wellness. And so we need to understand that the wellness piece is a lot more than just health. Health will be an outcome of wellness, achieving wellness. You know, and so when we start looking at our work and we're saying, what are we going to do next? You know, and Doug talked a little bit about it this morning. But in my view, what I really looked at, what our success has been, is that we've actually introduced a new way of doing good governance. And in my view, that good governance is going to carry us forward in the work that we have. Creating the Wellness 2027 strategy, and I think that's a better name for it now, because that's really where it's at. You know, because that's how we got the ability to create the purpose for why we need to work together. And the directives that we were able to engage, or that we got through our engagement processes and working with the province and BC and all the First Nations, that is the stuff that came from them. We just recognize that. You know, and I really liked how Doug explained this morning. He asked, well, what does a First Nations Health Council do? Well, it's leadership and advocacy. And that's really what we've taken to heart. So we're taking on a responsibility to help provide some leadership and share that with you. And for us to be able to coordinate and collaborate together on working on these things is very significant. You know, I look back into, you know, I represent our caucus, Vancouver Coastal Caucus, and our roots aren't that deep. You know, we've sort of got a fragmented caucus because we've got Coast Salish, we've got Interior Salish, and we don't have that history of working together. We don't have that political organization. You know, there's limits in programs and services and those types of things, but for us, it's about how we start to work together and be part of the bigger process. And so we need to learn from each other first. We need to learn how we work together. What are our processes? We're different, but at the end of the day, our values and principles are the same. And when you look at the governance process that we've been able to create through the health process, those principles and values are the same for all of us. And how we interpret them is very similar. How we apply them, how we use them to address our needs and our priorities is there. That flexibility is there. We have not prescribed how you do the work. We've created the time and space for the work to be done. And so when I look at the wellness determinants and the challenges that are there, and there's many, it's all about creating that time and the space. It's about getting our voices heard. It's about us informing and sharing that decision making. It's an administrative arrangement. And I think if we keep that focus, it's going to carry us through. You know, and because, you know, when we deal with our friends, you know, and other people talked about earlier, when they talk about us, they really don't know who we are. And there's still some level of that still here, because we've just started. And so I think at the end of the day for us, it's to understand that it is about good governance. If we follow our principles and our values, and we understand what the change is really about. And I think our priority is about taking care of all of ourselves. And so taking that responsibility back and having that ability to do that, to me, is the number one challenge. And so I think working together around all these determinants and issues around that, we have that opportunity. And so the challenge is for us, and I say us, all of us, as our leaders, elected leaders, hereditary leaders, our elders, and individuals, we got to start taking that responsibility for ourselves first and to deal with that work. And then through that, we'll be able to start creating healthy decisions. And so policy liberation, resource, freedom of resources, access to resources, access to our land and our resources on our land, to me is going to be the beginning of wellness. And we got to take care of those systems to help those systems be better, to take care of what we were forced into, especially around child protection, education, training, housing, the environment, food protection. To me, these are all the key pieces that we need to look at. And if I'm not mistaken, self-governance, if you throw that in there, that's all about what nationhood is. And so with that, I think that's all I've got to say today.